Another medical surgical nursing topic ang ali ko sa inyo for this week. We're gonna have your rhabdomyolysis. I promise I'm gonna break it down to you to the T. If you wanna know more about that, stay tuned. Welcome back to my channel. If you're new here, my name is Neil Gavin. I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students and nursing professionals like you with their studies. If that is something that you are interested in, consider subscribing. If you're already subscribed though, thank you so much for your love and support. I see you. I upload my nursing educational videos once a week. Don't miss that out. Subscribe now. Hit that notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help them know that you like to see more contents like this. Without further ado, nurses, let's jump into the video. Hi everybody, wherever you are right now, whatever time zone you're watching me right now, just wish you good morning, good afternoon, and good night just in case I don't get to see you. Isang panibagong medical surgical nursing topic nga ang alay ko sa inyo for today, Med-Surg. Medyo magpapahinga muna tayo sa mga nursing test banking video for this week kasi today I want to serve you with another discussion under your MS, your medical surgical nursing. So kagaya ng sinabi ko sa intro, you heard it right. We are going to discuss about your rhabdomyolysis. I'm going to break it down to you actually to the T. Yes, I promise that we're going to have your clear, I'm going to provide you clear clinical definition, diagnostic findings, medical procedures, signs and symptoms of course, and this will not be a nursing discussion if we're not going to talk about your nursing management. Now medyo mahaba nga po itong video na to, pero bago yung gusto kitang anyayahan, napakarami ko na nga pong ginawang video regarding sa yung medical surgical topic where I actually break it down some of the disorders that we have or we normally encounter in the area. And kung may mga requests ka pa about sa mga MS topic na gusto mong idagdag doon sa playlist na yon, please, I would really love to hear from you. Let's grow this community. Put it down in the comment section below, or you can also check out and follow my Facebook page. It's Neil Gabe. You can also comment there and follow mo na rin, share mo na rin sa mga friends mo. Ngayon, hindi ko nang patatagalin pa. Medyo mahaba itong video na to. Let me switch back to my PC and I'll see you guys in a bit. Hi everybody, welcome back sa ating formal discussion ng yung rhabdomyolysis. Yes, this is another entry natin sa ating medical surgical nursing playlist kung saan I actually provide you a thorough discussion about some of the concepts and diseases on review materials regarding your MS, your medical surgical nursing. Now, let this be your nursing study guide sa pag-aaral mo ng rhabdomyolysis. Now, the reason why I actually created this video, just for you, ma-share ko lang kasi recently I had a patient who were diagnosed with this type of disorder and I'm not really familiar on how to take care, the approach and the nursing interventions and how the disease process is for this type of condition. That's why I decided to create this video, for my own reference and also para ma-share ko sa inyo yung mga natutunan ko regarding this type of disorder. Now, kung hindi mo pa nga napapanood, maisingit ko lang kung hindi mo pa napapanood yung other videos I created under your medical surgical nursing topic. I'll be putting the actual playlist on the description box, including all of the nursing educational playlists I have on my channel. And also, whenever the icon button pops out, check that one out because I'll be putting it there. Alright, so these are the objectives that we have. We're going to answer the question about what is rhabdomyolysis. I'm going to give you the causes, the clinical manifestations, diagnostic findings, medical management, surgical management, and of course this will not be MS nursing lecture if we're not going to talk about your nursing management. Medyo mahaba nga po ito, but I assure you that this is going to be so interesting. Alright, you guys ready? Let's begin. So let's answer first the question, what is rhabdomyolysis? I'm gonna give you a clinical definition of this type of disorder. Alright, so rhabdomyolysis is a serious syndrome due to a direct or indirect muscle injury. Now, it results from the death of muscle fibers and release of their contents into the bloodstream. So when we talk about your muscle fibers, we're actually talking about your skeletal muscle. That's the type of muscle that is being affected by this type of disorder. Now, this can lead to serious complications such as renal failure or kidney failure, CKD. Ngayon, I will discuss more about paano nga ba yung breakdown ng muscle fibers na yun at yung mga contents na yun is pag nahalo sa bloodstream, umikot, nag-circulate sa entire body, paano siya nag-end up sa kidney failure. I am going to discuss to you that in a bit, alright? So this means that the kidneys cannot remove waste and concentrated urine. Now, these are the clinical definition of your, rhabdomyolysis. Now, in rare cases, you guys, rhabdomyolysis can even cause death. However, prompt treatment often brings a good outcome. Alright? So let's proceed. What are the causes of your rhabdomyolysis? Kagaya ng sinabi natin kanina sa definition. Now, there are many traumatic and non-traumatic causes of rhabdomyolysis. In the first category, the first category actually that I'm going to give you is the traumatic cause. Now, this includes the following. You ready? A crush injury such as from an auto accident, yung car accident, fall, or building collapse. Long-lasting muscle compression such as that caused by prolonged immobilization after a fall or lying unconscious on a hard surface during illness or while under influence of alcohol or medication. Electrical shock injury, lightning strike, or third-degree burn. And venom from a snake or insect bites. So these are the traumatic causes of your rhabdomyolysis. Huwag malilito ha, dalawang causes, traumatic and non-traumatic. So diniscuss ko sa inyo ito nakikita nyo apat na ito. These are the traumatic cause of your rhabdomyolysis. Now proceed na tayo. What are the non-traumatic causes of your rhabdomyolysis? Ito po siya. The use of alcohol or illegal drugs such as heroin, cocaine, and amphetamines, shabu. So sa mga drug users natin na gumagamit ng heroin, cocaine, amphetamines, there are actually risk factors or high risk for developing a rhabdomyolysis. What else? Extreme muscle strain, especially in someone who is untrained athlete. Untrained, you guys, huh? Don't forget that. I change my pen here. Untrained athlete. This can happen in elite athletes too, and it can be more dangerous if there is more muscle mass to break down. What else? The use of medications such as antipsychotics or statins, especially when given in high doses. Statins, ano to? Yung mga atorvastatin, yung mga anti-hyperlipidemic drugs natin. Antipsychotic drugs, those are used to treatment of mental illness. All right. So what else? A very high body temperature, hyperthermia, or heat stroke can be one of the non-traumatic cause of your rhabdomyolysis, seizures, and delirium tremens. What else? A metabolic disorder such as diabetic ketoacidosis. Yes, one of the non-traumatic cause nga ng yung rhabdomyolysis is your DKA, diabetic ketoacidosis. Ngayon, kung actually maisingit ko lang, nagkaroon din ako ng discussion nito about sa DKA. I believe, if not, gagawa tayo. I-discuss natin to. Check out mo yung MS playlist natin kasi napakarami na nga doon. Hindi ko na nga mabilang kung ilan na yung nagawa kong lecture material regarding sa MS. Pero ang dami-dami na and there's still more to come. Ngayon kung may mga request ka regarding sa mga med-surg topic natin, ilagay mo lang sa comment section below. Now let's proceed ha. Moving forward, diseases of the muscles or myopathy. Pathy means disease. Myo means muscle, so disease of the muscles such as congenital muscle enzyme deficiency or your Duchenne's muscular dystrophy. All right. What else? Viral infections such as the flu, HIV, or herpes simplex virus, and bacterial infections leading to toxins in tissues or the blood streams. So these are your non-traumatic causes of rhabdomyolysis. Malinaw yon? Malinaw. Alright, let's proceed. Clinical manifestations na nga tayo. Paano nga bang presenting signs and symptoms nito? Ginawa kong mas pinadali. Okay? Now, the presenting signs or symptoms tend to reflect the primary disease process as well as superimposed symptoms of renal failure or muscle injury. On this slide, I actually going to give you the classic triad of symptoms of rhabdomyolysis consist of the following. You have your myalgia. Muscle pain in the shoulders, thighs, or lower back. Weakness of what? Muscle weakness or trouble moving arms and legs. And you have your tea-colored urine. Now, the muscle mass, bakit nagkakaroon ng tea-colored urine? The muscle mass of the patient, the concentration of urine and glomerular function can affect the color of the urine. Now, keep in mind that half of people with the condition may have no muscle-related symptoms at all. So, this is the classic triage of your rhabdomyolysis. Malinaw yon, myalgia, weakness, and muscle weakness, and tea-colored urine. Alright, so what are the diagnostic findings? Paano nga ba natin ito i-diagnose? Now, because patients may present without any obvious history or physical sign of rhabdomyolysis, clinicians must be aware of the potential subtle presentation and keep the possibility of rhabdomyolysis in mind. In the evaluation of blunt trauma in children, it is vital to remain vigilant for signs of child abuse or non-accidental injury. Consider rhabdomyolysis in cases of child abuse, drug overdose, heat-related events, and pediatric orthopedic injuries. Failure to consider this diagnosis could result in the most severe complication of rhabdomyolysis, pigment-associated renal injury. Rhabdomyolysis accounts for, here's your statistics, 5 to 25% of cases of acute kidney injury, AKI, in the adult patients. Rates in pediatric patients are still unknown. Since yung clinical presentation ng iyong rhabdomyolysis, this type of disorder is really difficult to diagnose because it is actually can be seen in some other patients in some other disorders. Now, that's why the medical team the doctor should be vigilant and, in considering this as one of the risk factors not really risk factors, but one of the things that they should rule out. Mapapansin mo sa kanya yung kanyang diagnosis, yung kanyang, clinical definition and signs and symptoms actually are very vague and very general. So that is why we need to be very careful because ang pinaka end result or end stage nito, ang pwedeng maapektuhan nito is yung kidneys. This can cause acute kidney injury. So, talakayin natin kung paano nga ba ito dinadiagnose, okay? So, the diagnosis of rhabdomyolysis is confirmed by detecting elevated muscle enzymes. The diagnosis of your rhabdomyolysis is confirmed by detecting elevated muscle enzymes in the blood, which include creatinine phosphokinase, CPK, SGOT, SGPT, and LDH. The levels of these enzymes rise as the muscle is destroyed in rhabdomyolysis. I created actually a video, a cheat sheet regarding your normal laboratory values. Medyo matagal na nung bago ko yun nasundan, pero I think I have part 1 and part 2. Don't worry. In the upcoming days, I will probably gonna add more videos regarding that. But just in case you haven't watched that, check out my channel. It's in there. What else is the other test that you can do to rule out rhabdomyolysis? You have your radiography, CT, and MRI. Imaging studies generally play a little role in the initial diagnosis of rhabdomyolysis. However, radiographs should be obtained when fractures are suspected. CT, or computed tomography of the head, may be necessary on a case-by-case basis when a patient with an altered sensorium is evaluated. Patients with significant head trauma may require head CT. A head CT scan may also be obtained in patients with first-time seizure activity. Naalala mo isa sa mga causes niya, seizures non-traumatic? Ayon. Or prolonged seizures, or in patients with neurologic deficits of unknown etiology. MRI is the imaging modality of choice for evaluating the distribution of extent of injury of affected muscles, especially when epiphysiotomy, or involvement of deep compartments is considered. Later on, we're going to talk about more about your episiotomy. What else you can do? You can do ECG. Bakit kaya nag-ECG sa rhabdomyolysis? Now, ECG should be performed early in the course of evaluation to evaluate for cardiac dysarrhythmias or dysrhythmias related to hyperkalemia or hypocalcemia. Kasi naalala mo, elevated ang iyong potassium and serum calcium sa blood. This can actually cause dysrhythmias, mga fatal dysrhythmias natin. Okay, makikita yon sa ECG. Now, ECG may reveal changes reflective of acute hyperkalemia, including peaked T waves. Ano ba yung makikita mo pag hyperkalemia? Peak T waves, prolongation of the PR and QRS interval. Ano pa? Loss of the P wave or in sine wave. Specific disease testing may be indicated to determine the definitive causes during or after short-term management of rhabdomyolysis. What else you can do? You can also do, or the doctor may also order, muscle biopsy. Now, this may be required to demonstrate immunohistochemical features of necrosis only if underlying and often inherited muscle disease is a concern. Lastly, you can do immunoblotting or immunofluorescence and genetic studies. Now, immunoblotting and immunofluorescence in genetic studies may be necessary to find evidence of inflammatory conditions or dystrophinopathies. All right, but these are the diagnostic tests you can do or you can expect for a patient who is the doctor is trying to rule out rhabdomyolysis. But I want you to understand that the confirmatory testing is actually your muscle enzymes. What are those? Creatinine phosphokinase, CPKP, SGOT, SGPT, and LDH. Malinaw yon? Malinaw. So, medyo mabilis ang discussion natin today. I wasn't expecting that. But proceed na tayo sa ating medical management. Now, assess the ABCs. Airway. Ano yung ABCs natin? Airway, breathing, and circulation. And provide supportive care as needed. These are the foundation, or not really the foundation. Dito iikot ang iyong medical management. Now, ensure adequate hydration and record urine output. Insert a Foley catheter for careful monitoring of your urine output. INO monitoring nga ang mga pasyente nating rhabdomyolysis because of the later effect nito sa ating kidneys. Naalala mo yung acute kidney injury and CKD? Yun. Now, identify the correct and inciting cause of your rhabdomyolysis. Example nga nito, yung traumatic cause, infections, and toxins, which is under saan? Non-traumatic cause. Okay, so tatalakayin natin siya in details sa mga susunod na slide. Now, let's proceed one by one. Well, we're going to start with your fluid resuscitation. That's one of your medical management. Now, expansion of the extracellular volume is the cornerstone of treatment and must be initiated as soon as possible. No randomized trials of fluid repletion regimens in any age group have been done. Retrospective studies of patients with severe crush injuries resulting in rhabdomyolysis suggest that prognosis is better when pre-hospital personnel provide fluid resuscitation. Support of the intravascular volume increases the glomerular inflation or filtration rate o yung ating GFR and oxygen delivery and dilutes myoglobin and other renal tubular toxins. Now, you guys, aggressive and early hydration with isotonic sodium chloride solution is important for the prevention of pigment-associated renal failure. Ang cornerstone nga natin sa medical treatment natin ng ating rhabdomyolysis is fluid resuscitation. Expect mo na merong ongoing isotonic solution dyan sa ating mga pasyente, okay? Plus, monitor intake and output. Next, bakit natin monitor ang ating pasyente yung INO? Para malaman mo kung functional pa ba ang kidney mo, kung may tama na ba. What is your normal urine output? 30 to 45 if I'm not mistaken, per hour. 30 to 45 cc per hour. Sa isang araw, 750 cc in one day. That's your normal urine output in the 24-hour count. Alright? So, prevention of acute
kidney injury and renal failure nga po. ARF develops in 30 to 40% of the patients with rhabdomyolysis. Suggested mechanisms include the following, nurses. Listen: precipitation of myoglobin and uric acid crystals within renal tubules. So these are actually the muscle fibers that were the breakdown of your muscle fibers, and then once it reached the bloodstream, hindi rin kasi na-filter out ng kidney natin yung mga ganitong klase ng mga muscle fibers. Yung ating uric acid, yung ating crystals, myoglobins. These are really hard for our kidney to filter out. Hence, kaya nag-re-end siya sa acute kidney failure. Now, decreased glomerular perfusion, nephrotic effect of ferrihemate or ferrihemate, you guys, kung hindi nyo natatanong, and globine are the breakdown products of myoglobin when pH levels fall to less than 5.6. Ferrihemate is one of the agents responsible for acute tubular necrosis o yung ating ATN. It contains iron, a transition element, which is free to accept and donate electrons. This results in the generation of free radicals which cause direct renal cell injury. Heme proteins may also affect nitrous oxide, dothylene receptors, and cytokines. AKI has occasionally, or yung ating acute kidney injury, has occasionally developed in severely dehydrated patients with peak CK levels as low as 2,000 international units per liter. To prevent renal failure, many authorities advocate urinary alkalinization, mannitol, and loop diuretics. Hence, kaya tayo nag-administer ng isotonic infusion or IV infusion. What else? Correction of electrolyte acid-base and metabolic abnormalities. Frequently monitored serum electrolyte levels, urine pH levels, and acid-base status. Metabolic abnormalities should also be addressed. Treatment of hyperkalemia. Naalala mo, tatandaan mo lagi when you talk about your rhabdomyolysis, papasok si konsepto ng hyperkal. Hyperkalemia consists of IV sodium bicarbonate, glucose, and insulin, oral or rectal sodium polystyrene sulfonate, and hemodialysis. These measures transiently shift potassium from extracellular to intracellular compartments. Administer IV calcium chloride for patients who are hemodynamically compromised and hyperkalemic. Ano pa? Hypocalcemia, decrease serum calcium in blood. If noted early in the course of rhabdomyolysis and generally, if not clinically significant, correct hypocalcemia only. If the patient has cardiac dysrhythmias or seizures, calcium may combine with phosphate, forming a metastatic calcification, often intramuscularly. Calcium supplementation is not recommended as hypercalcemia may be seen in recovery phase. Later phase na nga po ito ng iyong rhabdomyolysis. Doon nag-a-appear ang iyong hypocalcemia, Now, hyperuricemia, meaning increase uric acid in blood. And hyperphosphatemia rarely are the clinical significance and rarely require treatment. Control of hyperphosphatemia, if required, is achieved by using alkaline diuresis. Hypercalcemia may develop during the recovery phase, especially if there is acute kidney injury. Now, what else? Your last medical management is, medyo nahilo ba kayo, nurses? Kalma ha? Kalma. Balik-balikan mo lang tong video na to, okay? Now, your last medical management is, of course, your dialysis. You're talking about your kidney. Now, dialysis may be required in patients with oliguric renal failure, persistent hyperkalemia, other electrolyte abnormalities, pulmonary edema, congestive heart failure, and persistent metabolic acidosis. Once again, nurses, these are your medical management. Proceed na tayo sa ating surgical management. Paano nga ba natin ito tinitreat? Now, surgical care may be necessary depending on the cause of your rhabdomyolysis. Now, I list down one here. I'm gonna talk about your fasciotomy and treatment of fractures. All right, so compartment pressure should be measured when significant muscle injury has occurred. Muscle injury results from decreased tissue perfusion, which is caused by increased pressure within the affected space. High compartmental pressures mediate further ischemia, damage, and necrosis. When intracompartmental pressure exceeds 30 millimeters of mercury, episiotomy is advocated. Prolonged elevated intracompartmental pressure may lead to irreversible peripheral nerve injury. Limb fractures may require surgical and orthopedic treatment. Once again, this is your surgical management. Now this last slide na nga tayo ha, nursing management na. Excited na ba kayo? Excited na? Here we go. These are your nursing management. Now the way we're gonna approach this is based on 4 focuses, all right? Your hyperthermia, fluid volume, acute pain, and your fatigue. I kind of like colorate the nursing management with your medical management, all right? Para lang in line tayo with our discussion. All right, so let's talk about your hyperthermia. Now, I list this nursing diagnosis. So hyperthermia related to the inflammatory process of your rhabdomyolysis. Hindi ito kompletong nursing diagnosis ha. Depende pa rin yon sa secondary factor mo and yung sa yung objectives on objective signs and symptoms. Kung gusto mo mag-create tayo ng tutorial on how are you gonna formulate your nursing diagnosis, sabihin mo lang sa akin. Ako, may share ko sa inyo yung natalalaman ko regarding that. Kasi alam ko maraming challenge kung paano nga maraming confusion in regards to formulating your own nursing management and not management. Nursing diagnosis using your NONDA. Sabihin mo lang, i-comment down mo below. So, this is your nursing management when it comes to your, or nursing intervention when it comes to your hyperthermia. All right, so first one, you have your assess the patient's vital signs and at least every 4 hours. Bakit na? Ito yung rationale. To assist in creating an accurate diagnosis and monitor effectiveness of medical treatment, particularly the fever-reducing drugs administered to the patient. What else? You have to remove excessive clothing, blankets, and linens. Remember, we're talking about hyperthermia. Huwag mo nang dagdagan ng marami pang clothing yan, girl. Baka masyado mag-ima. Heat stroke pa yan nang wala sa oras. Bakit? To regulate the temperature of the environment and make it more comfortable for the patient. What else? Administer prescribed antipyretic medication. Why, nurses? Why? Now, use the fever-reducing medications to stimulate hypothalamus and normalize the body temperature. Aspirin helps elevate fever and reduces pain due to its anti-inflammatory property. Cautious lang tayo when giving aspirin because you need to this can actually, aspirin, as you all know, can cause Urey syndrome. Okay, so careful lang. So when we talk about, proceed na tayo ha. When you talk about your hyperthermia, of course, mayroon ka dyang TSB, offer tepid sponge bath. This is to facilitate, anong rationale ng TSB mo? To facilitate the body in cooling down and to provide comfort. Okay. Next, you have your elevate the head of the bed. Bakit kaya kailangan? Now, nurses, head elevation helps improve the expansion of the lungs, enabling the patients to breathe more effectively, hence lowering down the body temperature. All right, so these are your nursing management with rationalization when you're trying to deal with hyperthermia. Okay, next, you have your fluid volume deficit related to injury of skeletal muscles. Okay? Fluid hydration nga tayo. So, kailangan meron tayong fluid volume deficit as one of your nursing diagnosis. So, eto na tayo. Commence a fluid balance chart monitoring the input and output of the patient. Strict INO monitoring nga ito because of the fear of AKI, acute kidney injury. Bakit natin kailangang mag-start ng INO? This is to monitor the patient's fluid volume accurately and effectiveness of actions to reverse dehydration. Next, start intravenous therapy as prescribed or as ordered. Why? Encourage oral fluid intake as tolerated to replenish the fluids lost from profuse sweating and to promote better blood circulation around the body. Your main goal is to make the patient hemodynamically stable. Homeostasis, that's what we call it. Now, educate the patients or guardian or significant others on how to fill out the fluid balance chart at bedside. Ginagawa niyo ba to sa bedside? Actually, ginagawa ko to eh. May form normally ang mga hospital natin kapag ang patient natin may order ng strict INO monitoring, and then part of your nursing responsibility is to actually educate the family, the caregiver, and sometimes the patient to put the intake there. Every time the patient drinks, how many ml is that, what time, because at the end of your shift you're gonna collect that and put it on the patient's chart, because the next morning the doctor probably not just the intake but also the output. Normally we give our patients urinals with measurements just so they can put and track their own urine output, including the bowels, any vomiting episodes and stuff. You're also gonna monitor your fluid intake, enough IV fluid intake, including the medication, because that's part of the overall INO monitoring for your patient. So part yun ng responsibility mo to instruct your patient on how to fill out your INO monitoring chart, and your responsibility at the end of your shift is to actually put that on the patient chart and endorse it to your next yung karelyebo mo, the next shift. Okay, so that the next day when the doctor asks, or whenever the doctor asks the total 24-hour INO chart of your patient, then you have the answer and you're pretty much sure that you did your job well and you were able to help your patient in monitoring the INO for that particular day. What else? Monitor patient's serum electrolyte and recommended electrolyte replacement therapy. Oral or IV nga po ito to the physician as needed. Sodium is one of the important electrolytes that are lost when a person is sweating. Hence, very important nga ang ating serum electrolytes. Expect mo na dyan na may daily monitoring ka ng iyong blood electrolytes, serum electrolytes. Okay? So once again, these are the nursing management with their rationalization when you talk about your fluid volume deficits. Okay? Proceed na tayo. So, acute pain. May pain kaya yung ating mga pasyenteng diagnosed with rhabdomyolysis? Absolutely. Kasi nga, meron siyang muscle breakdown. There will always be myalgia. Naalala mo yung classic triad ng yung rhabdomyolysis? Meron kang myalgia, meron kang muscle weakness, and of course, tea-colored urine. Okay, isa-isahin natin to the first one is administer prescribed medications that alleviate the symptoms of your muscular pain. Now, bakit? Pain medications such as anti-inflammatory drugs that are given for pain relief in patients with rhabdomyolysis. Assess the patient's vital signs and characteristics of pain at least 30 minutes after administration of the medication. Now, this is to monitor effectiveness of medical treatment for the relief of pain. Bakit mo ina-assess 30 minutes before administration of your medication or your analgesia? Para meron kang baseline pain scale tayo, di ba? Sir, paano mo gagawin yun? So, sir, in the rate of 0 to 10, 10 being the highest, how painful is it? So that's how you're gonna ask your patient. So the time of monitoring of vital signs may depend on the peak time of the drug administered. Elevate the head of the bed if the patient is presenting with SOB, shortness of breath. Administer supplemental oxygen as prescribed. Discontinue if O2 saturation level is above the target range, or as ordered by the physician to increase the oxygen level and achieve the saturation value within the target range. Normally kasi ino-order ng mga pasyente, ng mga doktor sa mga pasyenteng may mga COPD, yung SpO2 kasi SpO2 target natin. Kasi hindi naman tayo pwedeng mag full blast ng oxygen kasi pwede tayo magkaroon ng carbon dioxide retention sa mga pasyente nating may COPD. So once na na-hit na natin yung target nating SpO2 sa pasyente, maintain lang natin doon. Halimbawa, 2 liters per minute. Hindi nagde-desat ang pasyente mo, so maintain mo lang siya sa 2 liters per minute. or try to win off the patient from oxygen. Depende pa rin yan sa order na sa prognosis ng pasyente and sa order ng ating mga doktor. Okay? Next, place the patient in complete bed rest. Bakit? Now, you have, as a nurse, you have to educate your patient on deep breathing exercise and relaxation techniques to promote healing and recovery. So once again, these are your nursing intervention when you talk about your acute pain related to the inflammatory process of your rhabdomyolysis. Malinaw sa inyo yon? Malinaw. Last one na to, ha? Okay, you have your fatigue. Bakit kaya may fatigue? According sa ating second 8 kong nursing diagnosis, fatigue related to injury of skeletal muscles. Yung fatigue, ito yung main problem natin, ha. Breakdown ko lang sa inyo, fatigue. Ang ating related to etiology, injury of the skeletal muscles. May mga parts kasi ang ating nursing diagnosis. Mag-create kaya ako ng video tutorial how to make or formulate your nursing diagnosis. Comment down mo or give this video a like kung gusto mong mangyayari iyon. Okay. So, proceed na tayo. Ano ba yung mga nursing interventions mo? Well, one, assess the patient's degree of fatigability by asking the rate his or her fatigue level is. Now, explore activities of daily living as well as actual and perceived limitations to physical activity. Ask for any form of exercise that he or she or your patient used to do or wants to try to create a baseline of activity levels, degree of fatigability, and mental status related to fatigue and activity intolerance. What else? Encourage progressive activity through self-care and exercise as tolerated. Now, you have to explain the need to reduce sedentary activities such as watching television and using social media in long periods of time. Alternate periods of physical activity with rest and sleep. Gradually increase the patient's tolerance to physical activity. May muscle pain na mga pasyente mong may rhabdomyolysis. There's a need for them to rest and to actually conserve their energy. Hence, you will encourage progressive activity and self-care and exercise, of course, as tolerated by your patient. What else? Teach deep breathing exercises and relaxation techniques. Provide adequate ventilation in the room to allow the patient to relax while at rest, to allow enough oxygenation in the room. What else? Refer the patient to dietitian and physiotherapy or your occupational therapy team as required to provide a more specialized care for the patient in terms of helping him or her build confidence in increasing daily physical activity and improving nutritional intake appetite. Malinaw ba sa inyo yun? Nako, nurses, tapos na nga tayo. Thank you so much for watching. Please like, share, and subscribe to my channel for more nursing educational videos. Let me know if you have other nursing topics that you want us to do in the future, commented down below. Abangan nyo nga po yung mga next video natin regarding sa nursing management. Okay, o sa ating MS. Okay, so kung hindi mo pa napapanood yung other mga video, yung napakarami ko ng videos na create, panoorin mo sila. Tulungan nyo na nga po ako ipamalita sa Radyong Sira, ang pinakabago, ang pinaka-fresh at ang pinaka-libreng nursing review center sa balat ng YouTube. And I'll see you again next time. You have a good one, nurses.
Thank you so much, you guys, for watching. I hope you learned something, help me grow my channel. You already here, you might as well subscribe. Hashtag Team Kulta. Give this video a big thumbs up and share with your friends. Let me know what you guys think. You put them down in the comment section below. Also, don't forget to check out other playlists I created for you. I'll be putting the links on the description box or simply click the second button right here. Let's connect. Follow me on all my other social media accounts. Everything is at Neil Gave except for my TikTok account, which is Neil Gave Official. I would also like to invite you to please like, share, and follow my Facebook page. It's Neil Gave, and check out the description box because it's right there. I'll see you again next time. You have a good one.